Praise be to Allah, the cherisher and sustainer of the worlds. I'm Dr. Ramsha Mushtaq Khan, and today I have the opportunity to present on the topic Types of Health Services under the kind supervision of Professor Dr. Saira Afzal. Quote of the day: Believe in yourself. You are braver than you think, more talented than you know, and capable of more than you imagine. Content outline: Introduction and types of essential health services, implementing services and addressing population needs, optimizing service delivery and guide for enhancing core functions, and recent advances and multiple choice questions. At the end of this presentation, the participants will be able to understand the main categories of health services and how they fit into the overall healthcare system, learn about the key features, benefits, and challenges of different health service types, recognize how various health services address different population health needs, and appreciate the global recent advances in the context. Health services are a vital component of the healthcare system and critical for improving population health outcomes. Different types of health services address distinct needs and play unique roles. The 10 essential public health services provide a framework for public health to protect and promote the health of all people in all communities. To achieve optimal health for all, the essential public health services actively promote policies, systems, and services that enable good health and seek to remove obstacles and systemic and cultural barriers such as poverty, racism, gender discrimination, and other forms of oppression that have resulted in health inequities. Everyone should have a fair and just opportunity to achieve good health and well-being. As shown in the framework, the assessment, policy development, and assurance are the core functions of public health. There are 10 essential public health services. To illustrate the function of these services, to identify under which essential service the public health activities in a community are implemented. More importantly, we will be able to understand how the synergy of efforts within all 10 essential service areas can contribute to the health of our community's populations. This table matches 5 of the 10 essential public health services with their corresponding quiz scenarios to help get started with identifying the 10 essential public health services and how they are reflected in a day-to-day public health activities. For example, in the first scenario, informing the public about an epidemiological outbreak investigation in a community, the essential public health service implemented in this case is investigate, diagnose, and address health hazards and root causes. Promoting enrollment in a federally subsidized health insurance program, the essential public health service implemented in this case enable equitable access. Health education and health promotion to prevent heart disease, communicate effectively to inform and educate, maintenance of a sanitary restaurant environment for public well-being, utilize legal and regulatory actions, shaping public health policy, city planning, and transportation routes to create an environment that fosters positive health behavior. The essential public health service implemented in this case is create, champion, and implement policies, plans, and laws. The 10 essential public health services provide a common ground for professionals trained in either public health or medical paradigm, as well as grassroots workers and non-public health civic leaders, so they can work collaboratively towards fulfilling the public health mission of promoting physical and mental health and preventing disease, injury, and disability. The 10 essential public health services are about actualizing the public health paradigm with key principles as a primary focus on the population, a public service ethic tempered by concerns for the individual, an emphasis on prevention and health promotion for the whole community, and a spectrum of interventions aimed at the environment, human behavior, and lifestyle and medical care. It is important to not only implement but also monitor, that is, track, assess, and modify as needed the 10 essential public health services. Why is it important to implement and monitor the 10 essential public health services? The theme of prevention is the most powerful element in the implementation of the essential public health services. Through prevention, countless injuries, illnesses, and even chronic diseases can be avoided. Through prevention, lives can be saved. Through prevention, healthcare costs can be contained. Through prevention, individuals, their families, and their communities can benefit from the population-based reach of the 10 essential public health services. How are the 10 essential services used in community practice? So now we will discuss this framework of 10 essential public health services one by one. Number one, assess and monitor population health. Public health surveillance, the ongoing systematic collection, analysis, and interpretation of health-related data is at the core of this essential service. It encompasses public health activities such as identification of threats to health and assessment of health service needs, timely collection, analysis, and publication of information on access, utilization, costs, and outcomes of personal health services, attention to the vital statistics and health status of specific groups that are at higher risk than the total population, and collaboration to manage integrated information systems with private providers and health benefit plans. The national level population-based surveillance systems administered by the Centers for Disease Control and Prevention include the Behavioral Risk Factor Surveillance System, National Vital Statistics System, National Health Interview Survey, and cancer registries. Community needs assessment. The national level surveillance data can provide trend data to use as a benchmark to assess health status measures. For example, the number of children immunized prior to entering preschool in a community. Prior to investing resources and time in a program, it is often necessary to conduct a needs assessment. Community data collected via a needs assessment can be compared to existing data at the national level. If it is discovered that the community actually has an excellent rate for a health status measure as compared to 75% of the states in the country, it may be advisable to shift the prevention program priorities to a different measure or target population. The guide for enhancing core functions and essential services for public health improvement for essential health service number one is analyzing community problems, assessing community needs and resources, collecting information about the problem, conducting concern survey, conducting focus groups, conducting interviews, conducting needs assessment surveys, conducting public forums and listening sessions, conducting surveys, determining service utilization, developing a plan for assessing local needs and resources, developing baseline measures of behavior, identifying community assets and resources, and understanding and describing the community. Number two, investigate, diagnose, and address health hazards and root causes. This essential public health services service encompasses epidemiological identification of emerging health threats, public health laboratory capability using modern technology to conduct rapid screening and high volume testing, active infectious disease epidemiology programs, and technical capacity for epidemiological investigation of disease outbreaks and patterns of chronic disease and injury. Agency for Toxic Substances and Disease Registry. At the national level, the Department of Health and Human Services oversees the Agency for Toxic Substances and Disease Registry. ATSDR, the agency's overall function is to serve the public by using the best science, taking responsive public health actions, and providing trusted health information to prevent harmful exposures and disease related to toxic substances. Via grants and cooperative agreements, ATSDR provides funding and technical assistance for states to identify and evaluate environmental health threats to communities as well as educate the communities about the health risks or other findings. Diagnostic testing and disease surveillance. At the local level, public health laboratories provide diagnostic testing, disease surveillance, applied research, laboratory training, and other essential services to the communities they serve. Laboratory work is diverse yet accomplished by highly trained and skilled professionals. Public health laboratory professionals and epidemiologists are the ones working behind the scenes on the issues including newborn screening, Lyme's disease, West Nile virus, foodborne illness outbreak investigations, and bioterrorism threats. The guide for this essential public health service is adapting community interventions for different cultures and communities, analyzing community problems, analyzing problems and goals, analyzing root causes of problems, the but and why technique, collecting information about the problem, conducting interviews, defining and analyzing the problem, designing community interventions, developing an intervention, ethical issues and community interventions, identifying targets and agents of change who can benefit and who can help, identifying strategies and tactics for reducing risk, and an introduction to the problem-solving process, understanding risk and protective factors, their use in selecting potential targets and promising strategies for interventions. Number three, communicate effectively to inform and educate. This essential health service encompasses social marketing and targeted media public communication. For example, toll-free information lines providing accessible health information resources at community levels. For example, free mobile health screening initiatives. Active collaboration with personal healthcare providers to reinforce health promotion messages and programs, and joint health education programs with schools, churches, and masjids, websites, for example, stress reduction seminars, parenting supports groups for enhancing mental health and health fairs. Effective communication, national media campaign advertisements on television, billboards, as well as posters or flyers. Some examples include the Back to Sleep campaign to prevent sudden infant death syndrome, or the anti-substance use campaign Just Say No. Many national awareness weeks are also related directly to public health efforts. The guide for enhancing this essential public health service is arranging a press conference, arranging news and feature stories, communicating information about community health and development issues, creating brochures, creating fact sheets on local issues, creating newsletters, creating posters and flyers, creating a website, conducting a social marketing campaign, developing a plan for communication, developing creative promotions, handling crisis in communication, implementing a social marketing effort, making community presentations, building capacity for community and system change, preparing press releases, preparing guest columns and editorials, preparing public service announcements, reframing the issue. Some lessons learned on community organization and change, talking about risk and protective factors. Number four, strengthen support and mobilize communities and partnerships. These activities represent a comprehensive approach to health, community health, in which professionals and even entire sectors of a community collaborate to plan, implement, monitor, evaluate, and subsequently modify activities and repeat the process as needed. This essential public health service encompasses convening and facilitating community groups and associations, including those not typically considered to be health related, to undertake defined preventive screening, rehabilitation, and support programs, and skill coalition building ability in order to draw upon the full range of potential human and material resources in the cause of community health. The patch logic model. This is not unlike the patch logic model, the planned approach to community health. Included in the patch strategy are 5 key elements and that are fundamental to the success of any community health promotion process. The guide for enhancing this core function is attracting support for specific programs, changing policies to increase funding for community health and development initiatives, community development, creating objectives, developing an action plan, capacity building for community and system change, evaluating comprehensive community initiatives, working together for healthier communities, a framework for collaboration among community partnerships, support organizations, and funders, developing a plan for getting community health and development issues on local agenda, developing an ongoing board of directors, developing strategic and action plans, developing successful strategies, planning to win, and identifying action steps in bringing about community and system change. Create, champion, and implement policies, plans, and laws. Public health programs are often funded and therefore document progress toward positive change in health behavior and health status indicators. It encompasses leadership development at all levels of public health, systematic community level and state level planning for health improvement in all jurisdictions, development and tracking of measurable health objectives as a part of continuous quality improvement strategies, joint evaluation with the medical healthcare system to define consistent policy regarding prevention and treatment services, and development of course, regulations, and legislation to guide the practice of public health. Active Living Design. Active Living by Design is a national program of Robert Wood Johnson Foundation, which establishes and evaluates innovative approaches to increase physical activity through community design, public policies, and communication strategies. The program funds community partnerships to develop, implement, and sustain collaboration among a variety of organizations in public health and other disciplines. Collaborators focus on land use, public transit, non-motorized travel, public spaces, parks, trails, and architectural practices that advance physical activity. One example of an active living by design initiative is the obesity and the built environment, improving public health through community design. The guide for enhancing this public health, essential public health service is advocating for a change, conducting a petition drive, conducting a public hearing, developing a plan for advocacy, Encouraging involvement of potential opponents as well as allies, filing a complaint, general rules for organizing for legislative advocacy, identifying opponents, lobbying decision makers, overview, getting an advocacy campaign off the ground, recognizing allies, surviving skills for advocates, understanding the issue, using personal testimony, writing letters to elected officials, and writing letters to the editor. Utilize legal and regulatory actions. This is number 6. This essential public health service encompasses full enforcement of sanitary codes, especially in the food industry, full protection of drinking water supplies, enforcement of clean air standards, timely follow-up of hazards, preventable injuries, and exposure-related diseases identified in occupational and community settings, monitoring quality of medical services, for example, laboratory, nursing homes, and home health care, and timely review of new drug, biological, and medical device application. Surveillance systems for this may be implemented in a community as a result of either state or federal legislation. Not only one can take on a leadership role in a community to assure that the public health regulations are enforced, but can also be a catalyst for change by identifying and prioritizing new issues and sponsoring new regulations through public health advocacy. The guide for enhancing this essential public health service is by adapting community interventions for different cultures and communities, building leadership, capturing what people say, tips for recording a meeting, coalition building, starting with a coalition, conducting effective meetings, creating and maintaining coalitions and partnerships, developing a plan for building leadership, developing a plan for involving volunteers, strategies for community change and improvement, social action using principles of persuasion, designing community interventions, developing a community leadership corps, a model for service learning, developing a plan for increasing participation in community action, and developing facilitation skills. Enable equitable access. This 7th essential service encompasses assuring effective entry for socially disadvantaged people in a coordinated system of clinical care, culturally and linguistically appropriate materials and staff to assure linkage to services for special population groups, ongoing care management, transportation services, targeted health information to high-risk population groups, and technical assistance for effective worksite health promotion disease prevention programs. The surveillance systems for this essential health service, the implementation of is inherently linked to the social, economic, and political climate in community, states, and the nation. To assure the provision of healthcare when it is otherwise unavailable, the United States federal government funds 2 safety net programs, the Medicaid and the State Children's Health Insurance Program. Enabling equitable access, the availability of programs like Medicaid and SCHIP is not sufficient. Public health officials also have to provide outreach services to the populations in need of these programs, which might include consumer education about the existence of a program, assistance with applying for a program, linking enrollees to health-related programs, for example, pregnant women, infants, and children under the age of 5 years enrolled in Medicaid also qualify for the federal supplemental program for women, infants, and children, and vice versa. Physically transporting clients to the medical services that they need. Guide for enhancing this essential public health service is developing multi-sector collaborations, identifying opponents, increasing participation and membership, getting an advocacy campaign off the ground, providing coordination, cooperative agreements, and collaborative agreements among the agencies, recognizing allies, survival skills for advocates, understanding and describing the community, understanding the issue, and applying for grants. Build a diverse and skilled workforce. This essential public health service encompasses education and training for personnel to meet the needs for public and personal health service, efficient processes for licensure of professionals and certification of facilities with regular verification and inspection of follow-up, adoption of continuous quality improvement and lifelong learning within all licensure and certification programs, active partnerships with professional training and programs to assure community relevant learning experiences for all students, and continuing education and management and leadership development programs for those charged with administrative and executive roles. Guide for enhancing this essential public health service is building leadership, building and sustaining commitment, building and sustaining relationships, building relationships with people from different cultures, capturing what people say, tips for recording a meeting, conducting a workshop, conducting effective meetings, collecting information about the problem, conducting needs assessment survey, conducting surveys, designing a training session, delivering a training session, defining and analyzing the problem, developing a community leadership corps, developing and communicating a vision, developing a management plan, developing a plan for staff hiring and training, developing a plan for building leadership, developing facilitation skills. Improve and innovate through evaluation, research, and quality improvement. This essential public health service encompasses ongoing evaluation of health programs based on analysis of health status and service service utilization data to assess program effectiveness and to provide information necessary for allocating resources and reshaping programs. The surveillance system for this program is evaluation helps public health professionals continually refine and revise program approaches in future years of funding. Furthermore, evaluation data provide information about the relative costs and efforts for tasks, so activity and budget adjustments can be made. Evaluation and assessment. The process of evaluation helps public health professionals and their collaborators assess the success of community health initiatives. Evaluation normally requires that data be collected and analyzed. Surveillance data from Essential Service 1 can be used for this purpose. For example, because surveillance efforts are often but not always annual, a community could assess retrospective and current or baseline data before planning a public health initiative. This baseline data could then also be used to document the health behavior or health status outcome measures of interest, both before and after the implementation of the guide for enhancing this essential public health service is the behavioral surveys, choosing evaluators, communicating information to funders for support and accountability, conducting interviews with key participants to analyze critical events, constituent survey of outcomes, ratings of importance, developing an evaluation plan, establishing formal communication and requesting participation, evaluating the initiative, a framework for program evaluation, a gateway to tools, gathering data on public opinion, gathering information, monitoring progress, gathering and using community level indicators, how to conduct research and overview, measuring success, evaluating comprehensive community initiatives. Build and maintain a strong organizational infrastructure for public health. In order to implement the 10th essential service, state and local health department staff might carry out health services research via many different efforts, including continuous linkage with appropriate institutes of higher learning and research, and internal capacity to mount timely epidemiologic, for example, outbreak investigations and economic analysis, for example, cost-benefit studies, and an internal capacity to conduct needed health services research, for example, survey designs, conducting interviews, facilitating focus groups, conducting clinical trials, and assessing and using public records. The guide for enhancing this essential public health service is adapting community interventions for different cultures and communities, assessing community needs and resources, conducting public forums and listening sessions, collecting information about the problem, designing community interventions, developing a plan for assessing local needs and resources, developing multi-sector collaborations, identifying targets and agents of change, who can benefit and who can help, identifying strategies and tactics for reducing risk, understanding and describing the community, understanding risk and protective factors, their use in selecting potential targets and promising strategies for interventions, and promoting coordination, cooperative agreements, and collaborative agreements among agencies. Now, recent advances. The Pan American Health Organization updates essential public health functions for countries of Americas. The Pan American Health Organization urges the countries of the Americas to renew the essential public health functions to provide quality public health services and actions to address epidemics and to advance towards universal health coverage. The COVID-19 pandemic clearly showed that there is a need for stronger health systems that promote and protect population health. This is the essential public health functions renewed framework for integrated public health policies, which includes a core function of resource allocation. Now it's time for the MCQs. A public health department is implementing a social marketing campaign to promote physical activity in the community. This aligns most closely with the essential public health service. A, assess and monitor population health. B, communicate effectively to inform and educate. C, strengthen, support and mobilize partnerships, enable equitable access. Or E, utilize legal and regulatory actions. The answer is B, communicate effectively to inform and educate. The Punjab Health Department is investigating a cholera outbreak linked to contaminated water sources. This exemplifies the essential public health service. A, build a diverse skilled workforce. B, create, champion and implement policy. C, investigate, diagnose and address hazards. D, build a diverse and skilled workforce. And E, utilize legal and regulatory actions. The answer is C, investigate, diagnose and address hazards. A community in Karachi has come together to address high rates of diabetes and obesity. They are engaging diverse partners to develop culturally appropriate programs and policies. This demonstrates the essential public health service. A, assess and monitor population health. B, strengthen, support and mobilize partnerships. C, investigate, diagnose and address hazards. B, build a diverse and skilled workforce. And E, enable equitable access. A. No, the answer is B, strengthen, support and mobilize partnerships. The Khyber Pakhtunkhwa Health Department enforced regulations on the manufacturing of gutka and pan masala containing tobacco. This exemplifies the essential public health service. A, enable equitable access. B, communicate effectively to inform and educate. C, assess and monitor population health. D, build a diverse and skilled workforce. And E, utilize legal and regulatory actions. B. Yes, the answer is C. A local health department enforced regulations prohibiting smoking in restaurants and in restaurants and bars. This exemplifies the essential public health service. A, enable equitable access. B, communicate effectively to inform and educate. C, investigate, diagnose and address hazards. D, utilize legal and regulatory actions. And E, build and maintain infrastructure. D. The answer is D. Yes, the answer is D. A state health department is providing cultural competency training for staff to improve speaking services for non-English speaking populations. This aligns most closely with the essential public health service. A, investigate, diagnose and address hazards. B, build a diverse and skilled workforce. C, investigate, diagnose and address hazards. D, enable equitable access. And E, utilize legal and regulatory actions. B. Yes, the answer is B. A public health organization is evaluating the effectiveness of a falls prevention program for seniors. This demonstrates the essential public service. A, enable equitable access. B, improve and innovate through research, investigate, diagnose and address hazards, create, champion and implement policies. And E, utilize legal and regulatory actions. A. The answer is B. A local health department is publishing data on air quality measures and trends in their community newsletter and website. This exemplifies the essential public health service. A, enable equitable access. B, investigate, diagnose and address hazards. C, communicate effectively to inform and educate, build a diverse and skilled workforce. And E, utilize legal and regulatory actions. The answer is C. A state health department is using grants and partnerships with universities to conduct research on environmental health threats. This demonstrates the essential public health service. Enable equitable access. B, communicate effectively to inform and educate. C, investigate, diagnose, and address hazards. D, improve and innovate through research. And E, create, champion, and implement policies. The answer is D. The Pan American Health Organization has worked with member countries to expand access to COVID-19 vaccines through COVAX facility. This exemplifies the essential public health service. A, enable equitable access. B, communicate effectively to inform and educate. C, investigate, diagnose, and address hazards. D, build a diverse and skilled workforce. And E, utilize legal and regulatory actions. The answer is A, enable equitable access. This is the key of the MCQs. This is the YouTube link of the channel. Please like and subscribe, and thank you very much.